Executive Director at the Department of Community Health over policy, operations and compliance. So basically all things policy, and I have been the business owner really since its inception. Just some housekeeping things to start with. I'm using a hotspot in my home to ensure that I have good connectivity. We haven't had any problems in the other two connections, but we have had a few people, just one or two in every presentation, who has trouble hearing. I know we would put out a chat message that said that if you're using headphones, that's probably not the best idea because that seems to be the common denominator of hearing problems. But I know also there's just been some connectivity issues this week, so it may be that as well. But if there's a large number of people that are having connectivity issues, go ahead and put that in the Q&A. We'll hold up for a second and make sure it's not on my end. Thank you. I always start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable, quality health care through effective planning, purchase, and oversight. This is basically an outline of what we're going to go over today. I'm going to assure you don't have to listen to me today. I have done a lot of these introductory webinars on EVV, and you're probably tired of hearing of me. And I'm tired of talking about the introductory stuff too. So we're going to try and keep that to a minimum and let you talk to TELUS and the Conduit TELUS team, who is really going to show you some things you haven't seen before and move the process along a little bit. But I do want to do just a quick, brief recap at the beginning. Then we'll turn it over to the TELUS folks. Then I'll come back and tell you how we're going to communicate with you ongoing, our timeline, all the different ways that you can keep track of us at DCH and the EVV process so that you're fully informed. And then we'll do a little bit of a Q&A. We've had two really great presentations so far, one on Tuesday, last night at 7 p.m., with a lot of positive questions and comments and a lot of great follow-up positive comments and questions as well to our EVV mailbox. So I really do want to thank you for joining us before we even get started. So I get asked a lot, and I have for the last 3 years, why are we doing EVV? Why even do EVV? And the bottom line behind that is because it's a federal mandate, 21st Century Cures Act. And non-compliance with EVV at the state level leads to a penalty. A percentage of the federal tax dollars gets withheld in the state of Georgia, and it goes up every year. So we spend hundreds of millions of dollars in personal supports or community living supports. Hundreds of $1 within the waiver and our state program for children GAP. So it's a significant penalty to the state if we do not implement EVV. Every state is implementing EVV and all the territories. So there is no state that is choosing not to implement EVV. Initially, we got a good faith exemption to delay implementation of EVV from January 1st, 2020 to January 1st, 2021. We were supposed to go live last January, but the federal government allowed us an extra year to implement. And it's also important, home health services do not come online till January 1st, 2023. I've gotten a lot of questions this week about, we're starting with home health, The Act does require home, but not until January 1st, 2023. And we'll go over exactly what services are covered under EVV in just a second. We just talked about the good faith extension. We will not meet the January 1st, 2001 exemption. The exemption for the go live. We will be fully operational April 1st in a pilot format, and then we'll do a soft launch in mid-May for everyone, and we'll go over these dates again. And then mandatory implementation for all folks using the TELUS system and processing of claims will start July 1st, and 21. We realize this doesn't meet the federal deadline, but we are committed to standing up a quality system with a pilot and a soft launch so that our members and our providers can get used to using the system. So what are the primary goals of EVV? You always hear about fraud, waste, and abuse, fraud, waste, and abuse. And where that really was the start of EVV, we want to make sure we leverage EVV for different reasons as well, which is to improve the quality of care and health outcomes, verify services were rendered, and reduce billing errors and claims accuracy, make it easier for the billings and claims accuracy. For me personally, I think there is a tremendous upside to EVV. We hear all the time complaints about missing appointments, late appointments, not having staff that can adequately come in when they're supposed to come in. Will allow for a tool for agencies and members to know how often their aides are meeting what is designed by their plan of care and the needs as outlined in their plan of care. So what is EVV? I think I told this in the last meeting that I was having a conversation with a friend of mine a couple of days ago, and he was asking, kind of about work and some of the projects, and I was explaining to him a little bit with EVV, and he said, oh yeah, I know what that is, because he just had a service worker come to his house to do some plumbing work, actually. And when the guy got there, the guy said, hello, I've just arrived. I'm signing in at your house. Will you check off that I'm here on my phone? And the guy thought it was weird, but said, sure. Then he did the work. The guy reviewed on his phone what services he had done, and then signed himself out. And my friend signed him out as well, saying that they were done and those were the appropriate services that he had done. He also then paid for the plumbing services based upon what was on there. That's exactly what EVV is. It's an electronic data capturing system, near real-time processing, GPS-based, and Telus will talk about that in a bit. It can be used in rural and in urban settings. There are alternate visits of recording besides just an app on a cell phone. There is an ability to transmit a variety of data, not just check out. But at a minimum, it does the things here on this slide. Type of service rendered, individual receiving the service, date of service, location of the service, who's providing the service, and the precise time when the service begins and ends. Also, many providers already have EVV systems. They realized years ago, even some before the 21st Century Act mandate, that there was value to their business in getting an EVV system. Georgia has an open model of EVV, which means you can use the state system, or you can continue to use your pre-purchase system, the system that you decided to buy, as long as it meets the federal guidelines and the state guidelines for EVV. We will work through an aggregator model to connect your EVV to our EVV. Saying EVV too much. So, who will EVV? And I told you I wanted to be very specific about what the services are that will impact. These are the ones. So in the new options waiver, the comprehensive support waiver, the independent care waiver program, the elderly or disabled waiver program, most commonly known as SOURCE or CCSP, and our Georgia pediatric program, which is in-home personal supports and skilled nursing for children. The workers are listed below, and these are what they are called, or you most commonly will hear them as. These are named as personal supports. In the now and comp waiver, we call it community living support or consumer-directed community living supports. In the elderly and disabled waiver, SOURCE, CCSP, and ICWP, we call it personal support services or consumer-directed personal support services. And in GAP, the Georgia Pediatric Program, we call it the personal care support services. We are not going to go over the appendices to this presentation. We are posting the presentation in its entirety. It has extras that I don't go over. Those are the appendices after I quit talking. And in Appendix B, you can see a complete list of the services that are not impacted by EVV. If you have those specific questions. In yesterday's presentation, we got questions about ASD, or Autism Spectrum Disorder Therapy Services. It is not currently impacted by EVV. So what's the role of case management? I'm getting this question a tremendous amount this week too. So tool in the toolbox for our case managers. They're going to be able to utilize and view the agency information for their members so they know when a member is always using all of their services and might need more, or when they're not using their services and maybe that's not the purpose for them as personal supports, because although they're brokered 20 or 30 hours a week, they're only using 2 or 3 hours a week. That should inform their plan of care to more properly build a plan of care. It's also going to use it for things like hospitalizations. The people who know the most and the quickest about one of our members being hospitalized, because a hospital may bill weeks after the person goes into a hospital. So we at the state level don't get that information. But the personal support aide will know immediately because they'll show up at that person's house and the person won't be there. And after a day, or even most times in one day, they'll figure out, what's happened. But if certainly not on the first day, they'll figure out shortly thereafter. So I'm going to turn this over now to our DCH vendor. We have Conduit and TELUS, and they will explain that. But I'm going to turn this over to Joe Schnurr. He's the Chief Customer Service Officer at TELUS, and I'm glad he's joining us today. Joe?
Brian, thank you very much. Great introduction, and I really do like the analogy with the plumber. I think it's very relevant. So hello, everyone. This is Joe. I'm with TELUS, and I'm going to walk you through a series of slides. One, I'm going to explain who Conduit and TELUS is and how we're different, and what roles we play. Second, I'm going to give you an introduction to the technology, because I'm sure you're all anxious to get an idea how it's going to work. And then thirdly, I'm going to speak about integrations with other EVV vendors. So for you providers that may already have an EVV system, we will be integrating with that system. And so I'll give you some more information on how all that's going to work. So first, about Conduit and TELUS. So we are both companies that work with Health and Human Services to provide technology solutions to solve many different problems, including EVV. Together, both our companies have almost 50 years of experience in working with state programs and a lot of really good experience with EVV. We are currently implementing EVV in multiple states and have completed implementation of EVV in other states already. So we've got a lot of great experience that will help you all work through this transition. And we will be providing demos and hands-on training, as Brian had mentioned, many times through the next couple months. So again, while today you'll get a sneak peek at everything and a high-level overview, there'll be much more information to come. So what roles are we going to play? So Conduit, who is the primary contractor for EVV in Georgia, plays the project management and project governance role. They're also in charge of the quality control, and they will be leading the customer service. So when we go live and you have questions and technical questions that you need to get answers and help with, you will be contacting the client service representatives from Conduit. What does TELUS do? So TELUS is an EVV technology provider. So we have built the technology platform that you all will be using. And again, we'll go through a high-level overview of what that is today. We'll also help you get trained on the technology. And we've already begun to do some of the outreach just to understand where you're at currently. So how does the technology work? There's two main components to the technology. A mobile application, which you see pictured on the left side of the screen, and an administrative portal, which you see on the right side of the screen. So if you think about what you'll need to do to use this technology, you're going to need to create your visits, you're going to need to complete the visits, and then you're going to need to be able to bill for those services. So the providers, the caregivers, the individual service workers that are going and providing the services, they're mainly going to be using the app, the mobile app. And this is just like any other app like Facebook or maybe a banking app, any other type of app that you may have already on a smartphone. And they're going to be using TELUS mobile app to clock in and clock out and check off tasks that they do while they provide services. So again, we're going to get into the detail, but at a high level, that's how that's going to be used. And then administrators of agencies and what we refer to as like billing providers, they're going to be using the admin portal to do scheduling. So for those agencies that like to centralize scheduling, you can centralize scheduling through the TELUS tool using the administrative portal. And then those schedules flow over into the mobile app. And then the other main function is going to be billing. So again, that's those tasks are usually done by a provider administrator and sometimes a case manager. So if we dive a little bit deeper on the admin portal, I had mentioned scheduling. There's also a real-time dashboard. So you can see the colored boxes on the screen here, and each one of those represents a status of the visits that are scheduled for that day. So one of the great benefits of having an electronic system is that an agency can get real-time updates as to what's going on with all of their employees and their staff out in the field. In a paper world, obviously, this is very difficult to do. But in an electronic world, you can understand who's checked in and in the process of completing their services, who may be running late for a visit, and who already has completed their visit. So that's what I mean by a real-time dashboard. We're also going to be getting a feed from Georgia on your service authorizations. So you may be getting those several different ways today. With EVV, we're going to be getting those electronically on a daily basis, and we'll be updating your portal with your authorizations. So this will keep them in a centralized location, and any updates to those authorizations will also be fed through and into the portal. And then you're also going to be able to provide or submit all your claims through the tool. And so again, we'll obviously go through that more in depth of how you'll do that. And then one more thing I'll just mention is that there is a capability through the tool to message with your staff in the field. So you can go in and enter a message on this administrative portal, and that message will show up on the mobile app. And vice versa, a caregiver may observe something in a visit, and they may want to make note of that. And if they want to alert the administrator, they can do that, and that message will show up on your inbox. So it's an internal HIPAA secure messaging feature, which a lot of the providers really tend to like. So let's talk about the mobile application. So first of all, like I mentioned before, it's really the same as any other mobile app that you would download. It works on a smartphone or a smart tablet. It's downloadable from either the Apple Store or the Google Play Store. And then there's two features that I want to share with you that we get a lot of questions on. The one question is, well, what happens if I don't have any cell coverage? Neither cell nor Wi-Fi. How do I complete a visit? So the app has what we call an offline mode that allows you to complete the visit even though you don't have cell coverage. And then when you do get back into an area with coverage, the app will automatically send that information off to the TELUS system. So that's an automated mode that kicks in when the app recognizes that there's no internet. You don't have to turn it on or off. The second question we get is, are you tracking me? So we are not tracking anybody. What we do is we use GPS to take a snapshot of location when you start the visit and when you end the visit. And that is part of the federal requirement. So the Cures Act, as Brian pointed out, we must use electronic means to verify location. And so we use GPS to do this. But again, we do not track at any other time. So what you're seeing on the screen now is a workflow of how the app works. So the screens go from the left side over to the right side. So it begins with your calendar, just as it's the same, and it actually looks very much like a Google or a Microsoft type of calendar that you may be utilizing today in your personal or professional means. And so for a caregiver in the field, today they may be managing their calendar through paper or something like that. Now they're all going to have it on their mobile app. So when they're ready to start the visit, they're just going to click on that visit. It's going to take them to the check-in screen where you can see they have two options. They either start the visit or for some reason they cannot start the visit. If they cannot start it, they choose that button and it will give them some options to choose why they can't start the visit. But most of the time, they're going to start the service by pressing that button. That will take them to the next screen that will list what service and what tasks you're required to do in that visit. In this example, you can see cleaning and cooking are my two tasks. And me as the caregiver, I checked off those boxes because I completed those in my visit. When I'm done, I hit the all services complete. That takes me to the checkout screen where I capture a signature for the recipient and myself, the caregiver. If there's a reason why maybe I could not capture a signature or the recipient's not available and maybe a legal guardian is going to sign, all of those things can be facilitated through the app. At that point, I am done. And I hit the complete visit button, at which point it will take me back to my calendar and it will give me a message that the visit was completed successfully and verified through the application. So hopefully, again, that gives you a quick snapshot of the technology. Again, there will be plenty more opportunities. We're going to demo it in a live environment on some of these future calls. Of course, there'll be almost endless training for you all. So not to worry, you'll get plenty more detail as the months progress. Now I wanted to talk about the data aggregation. So this is for providers that are already using an EVV system. And one of TELUS's job is going to be to collect that EVV data from those systems. TELUS is an expert in this, and we have connected already with more than 80 different EVV vendors in multiple states. So again, lots of expertise in working with all the vendors out there. There will be a specific specification specific to Georgia that the vendors will have to meet. Vendors are used to this. Every state has requirements. We will obviously share those requirements with the vendors. And both the providers and the vendors will be required to sign a document saying that their vendor meets the specifications. And then you can see the last bullet here is if you do have a third-party vendor, we ask that you ask your vendor to contact TELUS at this integrations@4telus.com email. Again, most of the vendors are already in conversations with us through that email, but just to make sure, if you could contact your, ask them to reach out to us specifically about working with providers in Georgia. So again, just to review, providers will have two options for EVV. One, they can use the state procured system, the DCH system, which is operated by TELUS, and no cost to that option for the providers. However, providers can also choose to use what we call an alternative system, or maybe a third-party EVV system. Again, it must meet the specifications specifically to DCH, and then any cost associated with that vendor's technology are all the responsibility of the provider. So we did a survey, which we actually got some really great responses. So we really appreciate you all participating in the survey. And one of the key questions was, if you are using a third-party vendor, who is it? So we could get a head start on who the vendors are. This is the list. These vendors that are shown on the screen are what we received in the survey. Again, 80 to 85% of these TELUS is already working with in other states. So that puts us ahead of the curve. If you do not see your vendor on this list, again, we would ask that you have your vendor reach out to us through that integrations@4telus.com email. Very important. So again, much more detail coming on third-party integrations, but hopefully this gives you all a head start. So Brian, I believe at this point, I turn things back over to you.
You do. Thanks, Joe. And sorry about clicking forward there. I'll accidentally click forward twice.
No worries.
So I'm going to take over. I'm going to go over it again. I know I talked about it at the beginning, but I want to talk to you about the timeline once again. Like Joe said, there's going to be many, many, many trainings and webinars between now, specifically webinars now, and the go live dates. I've got a bunch of them left to review. They are on everything from scheduling to claims resolution to very ones that are specific to consumer directed or participant directed services. We do hope to really go, really completely into a training mode around 2/17/2021. The system will be up in full production, ready to be used as of April 1st, 2021, but we'll be piloting it for a few weeks with a select group of providers across the state, big and small. We're going to use them to test out the system first. And then in mid-May, we're going to open the system up to everybody for what is considered a soft launch. We were talking to Indiana today, who took this same approach, and that gives everybody a chance to get familiar with it before all the claims are processed and things start showing up on your RA as they normally would, but they're going through the EVV system to do all the checks before it goes to the Gainwell or DXC, our Medicaid Management Information System for payment. That will be on 7/1/2021. We're going to stop and do some Q&A. We're not going to do it right now, but we're going to go back and do it at the end. But before I do that, because I want to go over a couple of more places where you can get information. But before I do that, I do want to take my first opportunity to let you know about the EVV Mailbox. It's been open now, I think, for well over a year, maybe two. evv.medicaid@dch.gov. If you think of questions later today, if you're like me and you always think of a question 15 minutes after the presentation, and you go, ooh, I should have asked that question. Well, guess what? You can. Just email it to this email address and we will get back to you. A large percentage of the time, you're just talking to me. Sometimes it might not be me, but most of the time it is just me. We will also take the opportunity, if you ask, if you need someone to reach out to you or talk to you or schedule time, we are willing to do that as well. That is not a problem. You just need to email us and let us know that. So, but I do want to go over, before we do a little brief Q&A section here at the beginning, I want to go over how we're going to share information, because I want to make sure everybody knows there are no gotchas here. We're trying to give you every bit of information we have in complete and total transparency. So there is nobody here who's trying to do anything associated with So we actually have an organizational change management team here, and they're helping us get the information out to members and providers in the community. They're doing it through a variety of methods. There was call campaign, there's all kinds of stuff we'll talk about. So we have, these are things we'll talk about. We have introduction to system requirements, member training, provider training, public forums, program events, stakeholder meetings and interviews, social media messages, and of course with providers, one of the big ways we communicate with you is through banner messages. If you don't know our EVV website, this is it. Information on our EVV website, including upcoming trainings and webinars. There is even a pontoon you can go look at that gives you the information about what is EVV. It's very informative. It's pretty widely used in education now, and something I didn't know about till about a year ago. But it's up on our website, incredibly informative. Again, there's our email address. We will be putting all of our PowerPoints and presentations on the website. Again, in open transparency. We're doing flyers and announcements, members and provider readiness surveys. We're also doing frequently asked questions and quick reference guides on specific topics. There are upcoming events. This is the last of our first introductory town hall meeting. We'll be meeting with SPAD in a virtual meeting on 11/17. We do plan on meeting, and we've met before with Gossip, Leading Age, and the AAAs, and any other association that reaches out to us and specifically wants more information. So next steps are doing that training, getting information about data, existing EVV systems for connectivity, and then figuring out ways that we can ensure minimal impact to Medicaid members and providers. Our goals is to do those things that are required by the 21st Century Cures, increase members' care and access to service, but also doing that with as little impact to Medicaid members and providers as possible. Other places you can get information from us. We have a Facebook page. We have a Twitter account. I don't do Twitter, but it's probably a thriller. We've got a DCH Twitter handle. We have a YouTube channel, and we also do a blog and news feed if you're interested in that as well. We have been periodically and with pretty regularity putting stuff out on all of our social media channels. So you may want to track these. Again, this is the EVV mailbox. If you want a specific answer, maybe want something written in writing, you're welcome to send it, and then you'll have it in writing, and it'll be just yours. Before we do the Q&A, I am going to say one other thing. I don't like to get into specific questions about individual circumstances on a public forum Q&A. I think we had 300 or 400 people in our first hall meeting. We had over 200 when we started this one today. It was at 210 when I quit looking. The nighttime meeting yesterday, I think we had 60, close to 70 people in that one. I'm very sensitive to HIPAA and PHI, and I want, there's a list of participants and people could figure out who you are and what you're talking about in your specific circumstances. And we won't be answering those questions. If you have specific individual questions, please send them into the mailbox and you will get a specific written answer right back to you. As of this morning, I had answered every question before yesterday. So there were some questions from yesterday that were not answered, but they will get answered by Monday. Okay, before we do our Q&A, I do want to thank you today. I know it's a Friday after, it's late and we've got great participation, but I really do want to thank you. I can't tell you how much it helps us and TELUS and Conduit to ensure we're getting a quality product through your questions and your input. Okay, I'm going to pause here. One, because I need to take a drink because that was a lot of talking for me. And two, queue up questions. Lee Clovis?
All right, thanks, Brian. We do have several questions that came in through the chat and the Q&A feature. I'm going to start with a few questions in the Q&A. All right, first up, we now bill CLS services under Now and Comp through GAMIS. Will this admin portal replace that GAMIS billing portal?
Yes, for CLS, your billing will go through the EVV system.
Okay. Can you clarify that RN, LPN private duty services are in GAP or not EVV?
No, it's only the code for personal support services.
Going through them, 1 second. Will this eliminate paper timesheets?
Yes, we hope it will eliminate paper timesheets associated with these specific personal support services.
Okay, I am self-direct and have employees. How will this change what I am doing now?
That's a great question. And it's one we've got. Hold on, I'm getting a little bit of feedback. Nicholas, I think I'm feedback in between you.
Okay, I'm gonna go on mute real quick.
Sorry, y'all. The feedback thing is, for me, working from home, if there's a lot of things I don't like about working from home. I'm just going to be honest with you. Feedback is probably the top of my list. It's just become part of your life. And it's not your fault because, first of all, your computer's way old and we have to get you a new computer. Okay, so side note, sorry, everybody. The consumer-directed question or the participant-directed question is a great question, and we've got it a couple of times now. Our goal is to, if the fiscal intermediary, to treat the fiscal intermediary as a provider who has their own EVV system. That is our hope. We have to confirm that with our fiscal intermediaries that everything meets. And if it does, then there would be no impact to the way your services are done now. It goes back to the minimal, impact to services. Now, if there are issues with the fiscal intermediary and their system, then that's a separate issue that we need to address. I know I got one question after our first town hall meeting, and it actually, I think it had 15 sub-questions within the one question. So the email started out with a question, and then there were 15 other sub-questions underneath it. And I responded to every single one, but the vast majority of the questions weren't really about EVV. They were concerns about kind of a fiscal intermediary and some of the things with consumer direction. We're happy to address that, but just not as part of EVV. We may need to address those things outside of EVV if there are performance issues or anything else associated with the fiscal intermediary and the relationship between the fiscal intermediary. It seems like there's a lot of training and technical assistance that might need to be done. Sorry, that was a long answer.
Thanks, Brian. All right, another question. Are we required to use the billing feature if we already have an EMR solution that does this and tracks authorizations?
Yes, billing will go through EVV. Because EVV is required to check all the components by the 21st Century Cures Act.
All right, can you provide some detail on how the services will work with our fiscal intermediaries?
We will at a later time. So like we said at the presentation, there will be specific presentations that are associated with consumer directed and fiscal intermediaries. I mean, I gave you an overview. It's kind of like high level, but don't worry, we're going to do some future training so that you're able to get specific information.
Okay, another question. Will structured family caregiving be a part of EVV?
No.
Does this impact CAG?
No.
Okay.
Guys, it was the list of services that I put on the slide. There's nothing hidden. Those are the services.
I'm just scrolling through some of the questions. Some of them you've already addressed. Give me one moment.
And I do want to encourage you after this is over too. Like I said, there is appendices to this presentation. Hold on 1 second. These will note what is not included. The access services, to answer the question that was just asked.
Okay. Ready for the next question? Okay. Will there be an option to call in if the app isn't working?
Yeah, we'll have multiple options. It's not working. Yes, we're focused on, because I hate to tell you this again, but can you unmute real quick? And it may just be me, but thank you. So there'll be multiple options that are available. We are encouraging the mobile app just because there is so much functionality that a member gets from that app and so much functionality as a provider that you get from that app. There's a ton for quality delivery of our service to our members by using the app, that when you start to go, well, I'm not going to use the app, I want to use this, I want to do that, you lose what's best. You lose what's best for the member loses what's best for tracking their care and ensuring the health and safety of our members. You lose that. But in the event that the system doesn't work, there will be options for calling in or using the administrative portal. And as a last effort, if there is no other option, we also have fixed devices that we can deploy. But that will be a very last, the vast majority of states are not providing that. They are saying you have to use the web app and that's it. But we're trying to give as many options as possible here, but we are going to continue to encourage the use of the web. And we're going to really make sure that there is a valid reason why not. Now, if it's on our end, then absolutely there will be ways to get around that. And, you know, I told this story before too. I used to work at a record store when I was a kid for many years. For those of you who grew up in Atlanta like I did, I worked at Peaches and Coconuts and Record Town and Tape World, right? I used to spray the peach smell every morning at Peaches down at Rio Mall when there was a Rio Mall, for those of you who are as old as I am, downtown Atlanta. And I was the worst about clocking in and clocking out. Like I got it in a performance evaluation one time because I just was like, okay, I'm here, I'm ready to work. So obviously there will be times when people don't clock in and clock out. And of course, we will have the functionality to be able to address those individual situations. Sorry, I'm done with that question, and probably a couple more.
That you did. You cleared up several of the questions here. Okay, another one that's come across a few times. What type of smart device or devices can the app be downloaded?
Joe, you want to answer that one, or you want me to?
I can take that. So it has to be a smart device, so it cannot be a flip phone. It needs to be at a certain level of operating system. So it's kind of less about the device and more about what the software level of the software is on the phone. And you can look at this by going under the settings and your software, and it will tell you what software level you are at. For example, an iPhone, I believe, is at level 14 right now. And so what we do is we keep current with the software that provides the security, because obviously we're dealing with PHI, so we have to be very secure. And at some point, the software providers, Apple and Android, they stop supporting software levels that go back too far. So I believe right now they're back to, like for the Apple, they're supporting back to software level 9. But at some point they're going to stop supporting 9 and go to 10. And then we're going to have to change. So it does change. I believe that in the FAQs, we will list exactly the software levels. But again, I wanted to just explain that because you may have an iPhone 5 that is several years old, but you may be on software level 14, so you may be fine. So it's more about that software than it is about the device itself. So hopefully that helps explain it.
Let's do a couple of more questions because I know we're getting close to time.
Yep, just a follow-up question to that one for Joe. Will this system need to be downloaded on a PC for claim submission?
So for the billing provider is going to do through the admin portal, and the admin is a web-based app. So you would open, for example, Chrome. You will go to the TELUS admin portal website, and you'll log in with your login credentials, and then you will have access to the portal. So that is done on a PC through any type of search engine. Again, there are specific search engine or engines that we can use. So for example, Internet Explorer is no longer supported because again, they don't support their security levels at a level that's acceptable. So we no longer support Internet Explorer, just as an example. So again, in FAQs, you will see the ones that we do support, but it is a web-based tool.
Okay, thanks, Joe. I think another good question's come up a few times. Can you explain the process for when a caregiver forgets to clock in or clock out?
That will be included as part of our training. That's a great question. So that would likely have to be done through the administrative portal. So that's going to be included in part of our later training. So no need to get too specific with it now, but we'll definitely go into that for training for others.
Okay, Brian, the more questions are coming over about how participants can find this information. I just wanted to put out there that we will be providing the recordings as well as this PowerPoint on our DCH EVV website.
I will go back to it, Lee Clovis. Hold on a second.
Okay. And hopefully we'll be able to post this as early as next week because it is a live recording. I'm sure our communications department will want to listen to it, confirm, verify the length of it, just making sure that we'll be able to upload it if they need to make any edits to it. So hopefully all that will be done by next week, but the PowerPoint can go up as soon as possible. So that will be made available.
And guys, you don't need to write down this website. You don't need to write down the website. If you go to Google and put in DCH EVV GA, it'll be the first thing that pops up. I think if EVV GA, it's the first thing that pops up. But I know if you put in EVV GA DCH, that website is the first one that pops up. I don't even have it set to my bookmarks. I realize I should, but I just Google it every time and go to it because it's just easier for me. All right, I think that's it. I think we're going to stop here. Again, I do want to encourage folks who still have questions or want a personalized response to utilize this email, evv.medicaid@dch.gov, that you can, dch.ga.gov, that you can see here on slide 28, and we will individually get back with you. I do also want to let you know that if you do want to request a conversation or a specific time, we will accommodate that to discuss with you as well. I also want to thank you for your input and participation today. It is vital for the work we are doing, and we appreciate you taking your time today. The emails, the questions, the comments, none of them are bad, and all of them help to improve the system. So the last thing I want to say today, once again, is thank you for your participation. I hope everyone has a good rest of the day and a very good weekend. Thank you.